Welcome to Big Butts No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? I am so excited today with Dr. Stephen Kemp out of Fort Worth, Dallas area in Texas, and you guys are in for a treat. We have so many things to unpack today. Thank you for being on the show, Dr. Kemp.
Well, it's awesome to be here. Super excited for our conversation, and I'm looking forward to covering some really cool topics.
Today's topic, you guys are going to be in for a treat with. We're going to really dive into, I think, beauty and aging and how beauty and aging affects us in different age ranges. And I really want your expertise, Dr. Kemp. I want you to help my girls, my listeners, they're my girls, help my girls with us. Aging has us in a chokehold. It's got us like this. So I need all the help, whatever you can do. Tell us besides how to combat it, what are the reasons behind it in the different age ranges? So let's start with our 30s.
Sure. I mean, I think, for the most part, people that are in their 30s, and I think most people that even aren't in medicine would go, those are young patients, young people. And you have the qualities of young skin, good hair, and generally speaking, the ligaments of our face, the structures around our jaw, are in the deep level, pretty firm, pretty snug. Where I think the 30s is impacted is in two directions, and for women, it's predominantly that post pregnancy bounce back, and it's skin changes, weight fluctuations, and breast deflation. And so I think three categories affect women in their 30s, and they're mostly thinking about how to get their body back after their pregnancies are over. Some women in their 30s start doing things like Botox, but actually not, um, you know, all of them, right? And so I think when most people get married, they're usually kind of mid 20s, maybe early 30s, and then their families kind of come. And I think that's the process of aging that I see hit them the hardest. And so you
Those
do all
kids.
these. They do they change things, and I think that pregnancy, obviously, the kid has you know a direct impact on the shape of the tummy, right? But then the wild hormone changes and then the weight gain that goes into supporting the pregnancy creates some downstream effects. So you have muscular structural changes in the way that the muscles line up. We call that a diastasis, when the muscles are loose and you kind of lose that hourglass and that tight waist. When the breast engorges and then the breastfeeding's over, the breast tends to deflate. And a lot of times it's either hollow or empty, and in some cases, hollow, empty, and saggy, right? And then with the weight gain and everything else like that, the skin can stretch, and it can stretch rapidly and create stretch marks or changes in the strength of the collagen underneath the skin, which makes keeping the same form and shape you had pre-pregnancy to post-pregnancy very, very difficult. And so a lot of women go through all of those changes and everything that we've all seen, and then really take charge of their lives all over again and work probably harder than they ever have in their life. And they find these frustration points. And so I think that's where, as plastic surgeons, we, kind of present ourselves. right? And so patients go, I've taken myself this far, and I want that feeling back. And so that's where the discussion starts. It's about kind of them feeling like themselves again, because you kind of remember yourself, starting your family, you remember yourself, and if you have a 5-year old or a 6-year-old kid, that's really not that long ago, but all of a sudden your clothes fit differently, and you're having a hard time recognizing the person that you've known all your life, and you want not only to just look a certain way. I think it's making you feel the way that you remember yourself, right? So that when you go out to dinner, you know, you feel not just like pretty, but you feel like kind of proud and confident. So people talk about things like confidence a lot, but I really think that, we get to know ourselves. We go through our teenage years, we figure stuff out, we get our first jobs, whatever the case may be. And so we develop along the way into the people we think we are. And when you have a major physical change in your 30s, and for women, mostly that's pregnancy, it can be really jarring to not feel like you recognize or have control over your life. And when you can do a few things to dial in to what those concerns are and make a connection, and then just be honest about what it is. It's about the trade-off of shape over potentially a certain scar or some other kind of thing. Because it is plastic surgery. It is not pure magic, even though when it goes well, it can feel like magic.
For sure, for sure. I can tell you, when I got off the table, I for sure felt like my surgeon had magic hands. So, our listeners, a lot of them are moms, and so you're speaking right to them. And we've talked about this on the show in previous episodes about how we lose ourselves in motherhood. And in my personal journey, I reclaimed myself after I had my mommy makeover. And I was able to see myself differently. And that is one of the reasons why I go so wholeheartedly into my show and helping other women through the process, because if I can help even just one woman feel as good as I felt, and I do feel after my surgery, like that, my mission's complete, because I feel like the more happier women are with themselves and with their how they look and what they see in the mirror, the happier they are just all the way around. Happy wife, happy life. It's 100% true. I want to talk a little bit about surgery in your 50s and what makes surgery in your 50s different. And I know you're going to just give me so much information on why it's different. The skin textures are healing, all of that. So let's really go into 50s and surgery.
Yeah, so I think that, once you get to be 50 and you're considering plastic surgery, it falls into um, a couple of different categories. Um, and the first category that I see a lot is patients that had some form of plastic surgery in their 30s, and 20 years later, they're looking for a refresh or an update. And a lot of times they've had breast augmentation surgery, and the implant, um, maybe the implant's actually doing fine. It's sitting in the pocket that it was placed in, and where the implant was placed when they were in their 30s was great, but now their skin has, essentially slid off of the implant. And that's incredibly common. And so these operations to kind of reset the breast, where you're not only updating the implant, but you're also trying to lift the skin to make a perfect match, are a little bit more involved than just an isolated breast augmentation. So you're typically talking about procedures that are, 30 to 45 minutes for a breast augmentation. And oftentimes these implant exchanges and lifts are 2 to 3 hours. So the surgery is just a little bit longer. The anesthesia is a little bit more involved. And then obviously you're also maybe a little bit older. So however fast you could run when you were 30 is a little bit less when you're 50. So all those things, play into not only what operation needs to be done, but just exactly how resilient you will be. And so I think preparing patients for the fact that they're updating their implants may sometimes be a little bit different than the surgery they had last time is a key differentiator. And then other women are in that stage of perimenopause where they kind of lose some energy and are having fluctuations in their hormones that create all kinds of problems, changes in the skin and changes in the ability to really feel energized about being able to bounce back from things. So um, that's a different category of patients because of those two kinds of things. And I think making sure we communicate that in the consult and get patients optimized for surgery is the pathway to success. So, as a surgeon, I feel like you have to identify that ahead of time differently than a patient that you're operating on in their 30s that doesn't have age-related changes, menopause-related changes. So the ability to communicate with your patients and offer optimization before the surgery, kind of like prep for your surgery, can be a differentiator. And in the last, 2 years in my practice, wellness has become a focus. I like using that term of kind of making people feel their best inside and out. And so we take this inside out philosophy with patients in their 50s, and we want to, make sure in most cases we're getting more extensive lab panels before surgery. We want to make sure that everything is optimized. And then we're also talking them more intently about ways to make sure that they're in anti-inflammatory lifestyles, both with their diet, with their routines, and then other ways to optimize how they're going to do. So whether it's protein supplementation and dietary considerations, or even simple things that can be done in a temporizing way, like NAD infusions, which can really help the cells function at an optimal level. And I think NAD plus is such a hot topic right now, especially in my office, because what we know is that with aging, that the cells themselves act like a thread, where the threads are being a little bit like kind of worn and tattered. And so, as a medical term, there's these ends of the cells called telomeres, which kind of break down and degenerate. And so, in skin cells, when these telomeres kind of break down and degenerate, what we end up seeing is loss of collagen, loss of skin textural support and integrity, and wrinkles. So externally, when we see aging skin, we know internally those telomeres have been a little bit frayed and tattered. And so what NAD plus does is it allows the cells to repair themselves and it prevents breakdown of those telomeres. So basically directly counteracts at the cell level what's happening with aging. And I think that when you do that and kind of optimize patients before surgery, you can convert somebody that's in their 50s to recover like somebody that was in their 30s. Whereas if you ignore that, you're basically asking the body to do more with less available resources, if that makes sense.
Wow, that is such a good explanation. Thank you so much for explaining that to us. I know my listeners are wanting to do anything and everything that they can to prepare for surgery. So these little tips and tricks that are you're talking about in your office and that's buzzing and with your staff, I know my girls want to know. The thought that came to my head as you were talking was this is I challenge my listeners to think about going to visit their plastic surgeon with the mentality of it's an anti-aging center and they're going to help me with all of the anti-aging things. And with my girls, I want to always recommend you to places that I know are going to take care of you. Y'all know that I don't really encourage you to go see a place that is charging you a little bit of money and treating you not so well and not giving you the adequate treatment that you deserve when you're having such big surgeries. And y'all know exactly what I'm talking about. So imagine like comparing that experience to an experience with a board certified plastic surgeon that I'm always bragging about my surgeons, and where they look at you and not just, okay, this is the surgery and this is what you get, and we'll see you at surgery, but actually look at you and see how can we optimize this patient to have the best recovery, but also like the anti-aging, all looking at a patient as a whole and not as just what, like this specific surgery, this specific procedure.
Yeah, I mean, I love kind of how you summarize that, Mavi. And I think, you know, one of the things that is difficult for somebody considering things maybe for the first time when they're trying to get into anti-aging or plastic surgery is kind of what's the right thing to do. And I think there's unfortunately been, a little bit of people kind of throwing shade at each other from the surgery side to the non-surgery side, right? So should patients be getting some sort of a surgical lift, or are they better off getting things like injections and fillers? And, how do you decide what you're going to do? And there's no question that there's, for a patient, more commitment to commit towards surgery, and it's generally more expensive. But one of the things to consider is what exactly are the concerns that are going on. And so if you can, achieve a happy patient, a confident patient, take the concern and have a solution-based pathway that is safe, that is reliable, that is all about open communication. That's what is ethical, right? That's ethical. And I don't think that either non-surgical treatments are always better or that surgery is better. I like to say that when we start talking about things like skincare, like injectables, and surgery, I really think that they're meant to go together. I say that to my patients all the time that they are better together. And in our own office, we have patients sometimes that will start off with one of my injectors and they'll have concerns around either their neck or their eyelid. And the injectors will, because of our relationship and our knowledge for each other's skill sets and how patients actually end up looking their best, have them meet me, for a surgical discussion. And at the same token, when I'm meeting somebody and maybe they're really early in the aging process and they're bothered by things where they recognize that, they're going through some aging changes, but they don't really need surgery. And when they realize that they don't necessarily have to do it to look a whole lot better, they're very happy. And I take them right over to my injectors and, you know, create an introduction for that conversation. And it may be, a few years later, it might be 10 years later, before they decide that a surgical treatment is going to give them that next boost. So I think when you see like a board certified plastic surgeon, that's kind of what we're supposed to do is I think that we're supposed to a little bit kind of quarterback the situation for a patient and kind of put them into a situation that's going to give them their greatest satisfaction. And there's not just the problem is when you ask these questions in isolation, right? You can't just say one person's picture or one person's face, I would do this treatment versus that treatment. I think the conversation is so pivotal.
So one of the things I also want to talk about that we talked a little bit off before we started recording, um, and you mentioned that you're seeing a lot of revisions in your practice, and that you're seeing revision breast work and revision abdominoplasty. I'm so curious about so many things. We talk about revision surgery on the show all the time. I tell my girls a little bit of revision surgery is not abnormal. Sometimes you just need a little bit to tweak. You don't want to go back to the surgeon that you already had your surgery with. It's okay. You can find another surgeon. But just know that your revision surgery is going to be more expensive if your first surgery is done very, very badly. And there's a lot of work to do. So try to get it right the first time. Go to the board certified plastic surgeons. Don't skimp on your surgery. Do it right because you want that first attempt to be almost out of the ballpark, if not out of the ballpark. And if any little tweaks need to be done, that communication with your surgeon is already there. And it's so good that you just tell them what you need. But that's not the reality of a lot of the people that are having plastic surgery at the moment. They're leaving the country, they're looking for less expensive options, and sometimes they don't get that care. What procedures are you seeing the most revisions of walking through your door? Like what procedure you're like, this one I see the most of?
Yeah, I mean, there's really three categories, and probably the the most common thing I see is patients seeking revision in a tummy tuck, and some of these, I think last month I did I think 9 tummy tucks, and the patient had already had a tummy tuck. Um, and so, so it was a whole new tummy tuck. And there's a theme, and most of those patients had some attempt at keeping the scar short, like not going totally hip to hip, or trying to do a mini tummy tuck when really the diastasis wasn't just at the lower pooch, but it was above and below the belly button. And so it kind of creates like a very uneven appearance to the tummy, and a boxiness to the hips without a true waist, which when I look at a well done tummy tuck, the scars can be shorter or they can be longer, but that depends on how much laxity in the skin the patient has, not how thin they are or how much weight they lost before surgery. You have to be within a range of your ideal weight. But everyone has just different skin snapback. And there are even patients I've seen that are sisters where they gained and lost about the same amount of weight with pregnancy, but their skin behaved differently. So it's not always the story that you heard from your friend or your neighbor or your sister that will apply to you. And so many patients come see us in plastic surgery because of word of mouth, because of referral, because of somebody else's experience. And I think one of the things that's really key is, yeah, that's a great place to start. That word of mouth and that experience and the reputation of the surgeon is great. And I think that in some way, the patient has to ask themselves, how well do I vibe with my surgeon? So I think one of the first things a patient has to ask themselves is, am I comfortable asking this doctor questions? And am I comfortable with the kinds of answers I'm getting? Because let's say that you do have some problem or change in the way you expect to heal from normal. You want to make that conversation easy, and you want to identify it sooner rather than later. And so that's kind of what I see. I see um, this tummy tuck, you know, dilemma where patients say, I don't want, you know, my scar going hip to hip. And if the scar is done nicely and the surgeon does appropriate, tummy tuck surgery and closes the incision with a lot of care and gentle handling and low tension, the scar line fades quite nicely. If there's a lot of pressure because you're trying to force extra skin into a short area, the tension on the skin is high, and then the scar tends to be wide, and the result tends to suffer. So that's just part of the communication. It's part of the consult. And, I think we all see patients that would be willing to accept some label of a mini tummy tuck, but they really need something that's a more proper tummy tuck. And because they just don't connect with the, consultation, they don't have the surgery. But I would say that it's way better to not have the surgery than to have bad surgery. Would you agree?
100%.
And so, I think that's the challenge. I think naturally, all the doctors I know and I talk to, all the plastic surgery people that I consider my friends, we got into this because we care about people, And so when you do that, you're always trying. And I think, we've all had friends, and, like a great example is like when one of my friends asks either me or my wife if we can pick up their kids on the way to somewhere. And we say, yeah, and we don't realize we have an errand to run here. We have to go to the bank. We're going to stop somewhere else off. And then before you know it, you're late, to pick up, your friends' kids and your kids for baseball practice. And it would have just been better to say, I can't do it. But you put yourself in a pickle because you're trying to come from a place of yes. And sometimes you just have to like take a deep breath and go, what is the total situation here? And make that recommendation if that makes sense.
That makes complete sense. Um,
So, I think that's what I end up seeing. I think that the tummy tuck categories, most of the time, there's a skin management problem, and it can be ugly or thick scars, or it can be the fact that the scar is not adequate enough to do the tailoring that's needed to give the patient a waist. So, liposuction's come a long way. I'm a big, big believer in, high definition liposuction techniques and really treating the whole body anatomically. I learned that directly from Dr. Hoyos years ago. And I think many of us doing, high quality mommy makeover and body contouring surgery really have embraced those principles. But, there's still thousands of plastic surgeons out there that just don't take that perspective towards the body contouring piece of it. And so I think that patients sometimes have those issues, whether it be contouring and shaping because liposuction isn't good enough, or just lack of communication about what exactly needs to happen in terms of the scar placement so that the waist is created. And so I end up revising a lot of, you know, poorly placed scars. I end up doing secondary liposuction on areas that weren't really paid attention to the first time. And then last but not least, but um, the thing about the belly button is you want to make it look like God put the belly button there, not like one of us did. And I think that I see a lot of, belly buttons that just could be better. And it's the last part of your tummy tuck. I would encourage any mom out there, any patient out there considering a tummy tuck to ask their surgeon, you know, like, how are they going to make the belly button look like there's not scars around it like a circle? And so the belly button on a person that you see that's had no kids, it's 20 years old, it's an any belly button, and that scar has formed because it dives inward like a funnel. So you should ask your surgeon, like, how do they make their belly buttons? And, how do you make sure that you don't see that it looks like a fake or surgically created belly button? And there's more than one way, but I think the key takeaway is you want depth, three-dimensional depth. So you want some distance between the outer opening of the belly button and all the way down at the bottom. And so your surgeon should be able to describe how they create a funnel-like shape to the belly button. So it's an innie, and where those stitches can be placed so they're not seen externally, leaving dots around the belly button. Um, and it's the last part of a tummy tuck procedure, the belly button is. So a lot of times, you know, people can lose focus, surgeons can lose focus, or they just don't cross the finish line, I guess is one way of saying it. And so you want to know that your surgeon's going to pay careful attention to that last part because, everything else can be great. And then that could be the one giveaway to an otherwise really good result. And it's just really frustrating.
it is very frustrating. I know my listeners, they love a good belly button. We all do. We talk about looking at belly buttons all the time. I want to point out something that you talked about, and I feel like this is a missing piece in my listeners' puzzle when they're looking at pictures online and they're saying, why is this liposuction so much better than this one? Why does this surgeon's lipo looks like this, but this guy's looks like this? and I want you to unpack it because um, you mentioned you went to go train with Dr. Hoyos, and also I know it's in your roots.
Yeah, yeah, yeah. You know, my mom will just kick me out of the family if I don't do a good lipo. Um, the I think that the Colombians and really the South Americans in general have taken liposuction to kind of like the level that it's at now, where it's artistic and it's anatomic, and it's not just about debulking. And so I want to give you an analogy of a pillow inside of a pillowcase. Does that make sense? Imagine pulling the pillow out of the pillowcase, and then the pillowcase just compresses together. So once the pillows pull out of the pillowcase, the pillow's case is skinnier, right? Does it mean that it's smooth and that there's no ripples? And so when I look at liposuction that I was first introduced to when I was in my residency training in the United States, the focus was on finding large areas, whether it would be a love handle or somewhere else, and essentially debulking the middle of it, and then putting patients into foams and compression garments so that it would all stick down. And so I think you're still removing fat and you're still really paying attention to the post-op compression. That part hasn't changed. What I think that the South Americans brought to the table was the point of view of an artist and a sculptor, and so several things need to happen for that to be consistent and reproducible. The first thing is you have to think artistically, you have to think anatomically, and you don't want to think about how much lipo volume you're removing. You want to think about where you're treating. So the surgeon should think of things in terms of zones of the body, where the natural muscle insertions are and where the natural edges of like the hip bones and the waist and the tailbone are. And so when you show those highlights because you specifically focus the lipo over those zones, it looks natural. And then when you create artificial lines, either they're too close together or they're not anatomic or they're just boring and straight, it also doesn't look very natural. And so that training in high def liposuction in Colombia with Dr. Hoyos changed my brain from I'm going to get this fat out and try to flatten it to I'm legitimately no longer just scooping something out and hoping it lays flat. I'm actually going to artistically sculpt it. And so the first part's the training and the thought process. The second part is it's really hard to do that kind of liposuction around different types of fat. The fat in the back and around different parts of the stomach has different fibrous nature to it. And so adding technology like VASER and MicroAire and PAL to the liposuction so that it's not just manual is number one, less traumatic, but it actually takes the fat from something that's very firm and stubborn to something that's more like clay, that's moldable. So the first part is thinking artistically. The next part is applying that technology like VASER and really advanced power assisted liposuction technologies, right? And then after all of that, you have the training, you have the technology, you have to, be able to do these different kinds of techniques. You have to understand how much energy you're going to deliver to the tissue, where exactly you're suctioning fat, and how do you create those transitions between that midline definition, which we call the linea alba, the edges of the rectus muscles, and when I see good liposuction, that's always there to some degree. Um, and the other category is what is the patient like preoperatively? So really, really, really chiseled out abs, which we call extreme high definition, can really only be done in a certain patient type and be natural. So they already have to be very muscular before the procedure to yield kind of extreme definition. And the majority of patients are going to fall somewhere into a more basic definition, which we would call kind of soft lipocontouring. Because if you create artificial edges in somebody who doesn't work out a lot or doesn't have really strong muscles, it's also not going to look natural. So I think those are the three pieces, kind of that training and then reshifting your brain from the ways of old to the ways of like anatomy or art anatomy or whatever you want to call it. And I think you need the right tools, right? So it's very hard to get the fat to behave the way you want it to unless you do something to make it softer, more moldable. It makes it a lot easier to be artistic when you apply these technologies. And then, it takes some time. So the liposuction surgeon has to be willing to change the position of the patient. They can't be in a hurry. It's a procedure that requires a lot of dedication. Um, the word for it is, I think, it's a big word, but you might guys like it, is kind of iterative. So what does that mean? So like when you look at a sculpture, right, it's built out of stones. When you look at something, it's a piece of rock. And how do you turn a piece of rock into like a human form or some other figure? Well, you take the stone away until what's left behind is what's showing. And so that's what you're doing with liposuction. So you're taking away from the parts that have been like shadowed so that the natural underlying beauty can shine through.
Wow, I love how you just put that together, and I 100% agree and see it. And thank you so much. Um, so, a question I always like to ask on the show, whoever's keeping tally, make sure to keep tally of this one. I always like to ask my surgeons, are you team drains or no drains?
Um, Team drains.
We all are.
And
I am too, and about 90% of the surgeons I've had on the show have been team drains.
so I will tell you that um, I, I tried to love no drains. And I think 5 or 6 years ago, I went through a kick where I just told myself, you know what, I'm going to lose the drain. And I think that you can do drainless procedures provided that you're doing more kind of limited treatment of the tummy tuck. And so every once in a while, I'll see some patients that don't need a lot of liposuction. Like I know that they just need a little bit of liposuction around some muscular edges, and they're super thin with just a little floppy lower pooch, right? And so I'm not going to put a lot of fluid in them, and I'm not going to create all this empty space where they can have lots of swelling, maybe even a seroma, those kinds of problems you want to avoid. But that's a really rare patient. And my patients that I do Lipo 360 on, I'm creating these spaces that I do liposuction on, and that fluid has to go somewhere. And if you put a drain in there, I find that the definition that I create on the table um, holds more true to what I sculpted on the table. And so my results, I feel like, are just a little bit crisper. And the trade-off is you have a drain for, a week, 10 days. And when I explain that to my patients, they're all for it. They say, what I want is I want the result. And so I think that for me is the thing. The result is king. And I'm able to be more artistic, create more specific shadows and definitions. And I have confidence with the drain in there that it's going to form down to exactly what I made in the operating room. Because even though we follow up really carefully and we'll send patients home with overnight nursing and lymphatic massage therapy, um, you're really not going to go home with them and rub that, you know, little shadow that you created day in and day out. And then so that drain is doing it for you, and the fluid that comes out of that drain, especially the first 2 to 3 days, you can imagine like it wasn't going anywhere else. So you just feel like you're very bloated. And I think that patients just not only look better, but they feel a little bit better faster. So that's been my experience, and that's why I team drain.
Team drains all the way. Keep count. Put that another one for team drains because I tell my girls, don't be afraid of the drains. You'll be fine. They'll be in there for a little bit. They'll be gone before you know it. And the benefit, you're going to have it for a long time. So,
Yeah, I just want to say one thing about that team drain thing. And I think that this comes up because I have colleagues, surgeons really like and respect that do no drain abdominoplasty. And I think that one of the things is they talk about if you do no drains, you don't have a higher rate of seromas or complications, and all that stuff is true. But they don't have an equal way of rating the result. And for every patient or for every, plastic surgeon that I've talked to that's experimented with drain and no drains, and the ones that I talk to, we're able to do a no drain abdominoplasty and patients are able to heal and not have seromas. But I will tell you, in my own practice, looking at my own results, my drain patients looked just a little bit better. And my friends that did the same thing, tried both ways, felt the same way. And I think one of the things about the no drain approach is you're putting in these tension sutures. They're called progressive tension sutures to close the dead space so the drain is not necessary. I still do that even though I put drains in. And so I think those anatomy defining sutures are helpful, but the drains are even more powerful in that final result. And it's, I think, really a no brainer. Just have a drain for a week and be the best version of whatever you can have.
absolutely. Before I let you go, Dr. Camp, I would really love for you to tell my listeners and me a little bit about you, your roots, where your mom, your love for plastic surgery, and where we can find you next.
Sure. So, I mean, I think, Um, well, I think in a format like this, it's always fun to talk about, you know, uh, where you came from. And my mom is Colombian. She came to the United States when she was 19 years old, and she met my dad in New York. And, my dad's just a normal American. But when you grow up as a kid, you're around a bunch of different little things. And so when I was, born, my grandma kind of came to live with us and help raise me with my mom, and they both spoke Spanish to me in the house, and so that was really, my first language. So as I grew up learning Spanish, loving the culture of South America, and so it's always not just something I've been born with by label, but just been a part of my life, from day one. So I think that that part of my heritage is a lot of fun, and I think as you pay attention to what's going on with plastic surgery and the popularity of it in South American countries, you get a pretty quick idea that my mom was talking to me about that as soon as she thought that I should be a doctor. So when I was a teenager, she was like, you should really consider plastic surgery. And I was like, nah, mom, I think I want to do like trauma surgery. I want to save lives. And as, kind of time went on and I learned more about, um, medicine, and then I figured out I wanted to be a surgeon. I think I realized how much I didn't understand about plastic surgery, how, connected and human um, this process is. And the reality is all of us have different things in life, but we're all going to age. And we're all going to go through transitional changes like pregnancy, like menopause, like aging. And the external changes can be really dramatic for different people. Sometimes they're not until you're in your 50s. Maybe you make it through your 30s and 40s looking just like you did in your 20s, and that's really a blessing. And God bless all of you who do. But eventually, Father Time catches up with all of us, and we feel like we don't recognize ourselves anymore. And that ability to talk to people about reclaiming themselves, taking control of their lives, really resonated with me. And so when I was doing surgery, giving people, their control back, putting things back together made a whole lot more sense to me than doing something like removing an appendix or a gallbladder where you're actually taking something out. And so in that case, you're making somebody better because something's gone wrong. But I don't know, the whole human side of being a plastic surgeon, I don't think gets enough attention. I think that too much of it is labeled as vanity, when really what we are is specialists in authenticity. We are trying to make everyone feel the way they think they're supposed to feel. And it's really cool to talk to your patients like that.
Wow, I love that. When you said that about saving lives, my first thought was, you do save lives. Having a nice figure and feeling good about yourself can bring somebody. I don't want to say it's not the solution to all your problems, but girl, it could solve some of them.
Yeah, no doubt. No doubt.
So thank you so much for being on the show today, Dr. Kemp. How can my girls find you?
So we've got Instagram, which I probably could do more with, but it's at Stephen Camp MD. Then we also have a plastic surgery Facebook page, Stephen Camp MD Plastic Surgery. And I'm also on TikTok at Dr. Stephen Camp. And so all those are kind of my social channels. But we're out and about in Dallas, Fort Worth. We welcome patients from all over the place. We get out of town patients, every month. If you're ever at a meeting or a plastic surgery thing, my wife and I, we stay fairly connected with the plastic surgery landscape and are active in our societies and meetings. So when you go to a Aesthetic Society meeting or American Society of Plastic Surgery meeting or a Texas Society meeting, a good chance you'll run into us over there. And for people that reach out to me, I manage my own Instagram account. I answer DMs, and so um, and these are topics we love. I mean, we live and breathe them, so it's never an intrusion, and so we welcome anybody to find us that way.
Wonderful. I love that. So if you are looking for some high definition lipo, a revision on your tummy tuck, a breast revision, or even a facelift. We didn't even touch on the facelifts yet. I think you have to come back for another episode. We'll
Yeah,
talk
I think
about that in this one.
yeah. I mean, I think that that's the thing, right? And that's what's confusing. And so there's not a whole bunch of us that do a really high quality facelift and a high quality tummy tuck, right? It's kind of either or. And you know, um, just for me, it was a natural transition. It's something, the way I think about putting things back together, whether it's you're adding or subtracting fat, whether you're tightening the muscles, and when you're redraping loose skin. So if you think of a tummy, it's three categories, right? It's extra skin, it's stubborn fat or misplaced fat, and it's muscles that are loose. And if you think of a face, we're tightening and repositioning the muscle layer. We're adding fat grafting to layers of fat that have, disintegrated or deflated. And then we're lifting and redraping the sagging skin. It just happens to be that there was one that's above the collarbone and one's below the collarbone. And so just taking care of my patients after I operated on them 10, 12 years later, their tummies are good, but their necks are not. And so I think that's definitely its own topic. And I think that there's really a lot to unpack there. It's probably the most exciting thing in my practice in the last 2 years, because for me, it's just it's a way to kind of stay connected to the patients I operated on 10 years ago. They don't need another tummy tuck. And that's cool, right? So you did your tummy tuck and it's holding up, and you have that great relationship, and now their neck is there right in front of you. They know you, they trust you, they know what kind of person you are, beyond what kind of doctor you are. And I'm really comfortable showing patients everything, right? So if somebody says, hey, I want to see what your tummy tucks look like, we'll show them our tummy tucks. And if somebody says, hey, you want to see what my face and neck lifts look like, we're going to show you results. So we'll just walk you through. I like to tell patients that one of the things is um, that I like to do in my consults is I like to just have my phone with me, and I like to say, hey, I haven't even posted these pictures on my website yet or on my Instagram yet. And I like to say, these are my last 10 cases. So I will say, this is my last 10 facelifts, and these are my last 10 tummy tucks. And what I like about that is that there's no cherry picking, right? You can look at my phone, you can date it, timestamp it, because people are like, are you only showing your best results? And I think that's true, right? All of us as surgeons are going to put results out there that we feel like are good examples, right? And, if there's like something that's not as good as the one before, well, why is that? And when I'm showing a patient like my last 10 facelifts, right? I can tell somebody like why the neck is cleaner on one patient versus another. So that's really important, right? So I'm the same surgeon, I'm trying just as hard, and we can talk about setting realistic expectations that way. And when we're looking at a tummy tuck, not all tummies are the same. And so even the best tummy tuck surgeon out there has, some results that are like the top five if a patient's grading them, right? And so I think what's really cool about just being in person with the surgeon is you just sit there and you go, these are my last 10 cases, no cherry picking. And the person that you're most like is this body type. So it allows them to kind of zero in on a realistic expectation that they can have, and not just necessarily the favorite picture that they have of my results.
You heard it here. So if you want to go see Dr. Kemp, give him a call, and I will see you guys next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.